heard a lady discussing with her friend. I took my child to the eye doctor, and the doctor said, my daughter needs glasses. I don't think I want my child to be wearing glasses. She's too young. Now the question is, at what age should the child wear glasses? And will glasses damage my child's eyesight? My name is Sĵpectacle. I'm a children's eye doctor, and I've been taking care of children's eyes for the last 20 years. Let me explain to you what spectacle wear has to do with your child and why your child may require one. Some children are born with vision problems, while others develop them later in childhood. Healthcare providers have noticed that eye problems develop, or the need for glasses develop, between the ages of 6 years to 12 years. And in some children, especially if they are far-sighted, they develop them when they are as young as 6 months of age. So a child will require glasses from 6 months of age, or even younger, depending on what. And there are guidelines, very clear ones, that eye care providers have been given or have developed to be able to know exactly when to give glasses. Let me explain to you all about spectacles and what it may have to do with your child. The brain is actually the organ of sight. The eye works exactly like a camera, capturing information and sends it to the brain where it is interpreted. Some children are born with vision problems while others develop it later in life. Healthcare providers who specialize in children eye care have noticed that kids usually become far-sighted or nearsighted between the ages of 6 years and 12 years of age. Far-sightedness may be diagnosed even earlier, sometime in infancy, and may be associated with crossed eyes, what in local parlance is called 430 eyes. Giving children glasses as soon as the need is determined is very important, and this allows them to participate in the same visual world with children who are normal sighted. However, studies have shown that the non-compliance rates are as high as 70% in some cases. If the child does not wear glasses as prescribed, normal visual development can be adversely affected. This is the reason why there are clear guidelines on giving glasses. Your child will not be given glasses if it is not required. Your child can also be checked to see whether there is any vision problem or not. But you must take the child to see the eye doctor. Mummies and daddies, you should know when your child is having any eye problem. Michael is one of my patients. He's 7 years old. He sits in front, but still he cannot see very well the blackboard. This was noticed by the teacher, and noticed that he copies frequently from his friends. He disturbs the class, he's very rough, disturbing other children, often looking bored even when she's teaching. And especially it was noticed when she was writing on the board. So she said to herself, could something be wrong with this boy's eyesight? When she discussed with him, found out that he seemed to be a very intelligent child. So she called him and asked him, is anything the matter, Michael? Michael replied, I can't see the board well. She now said, did you tell your mom and your daddy? Michael said, I told them, but they don't believe me. So Miss Briggs, this is the name of the teacher, now said, it's better I discuss with your parents. So mummies and daddies, you need to know the signs. One of the signs is when the child is squinting or narrowing the eyes, when the child is having to move close to the television, when he bumps into objects, when they frequently rub the eye, they complain of headache, they don't want to read when other people are reading, they disturb. Do you know that your child could be diagnosed to be having an attention disorder just because he requires glasses and you refuse to notice the signs? You need to take your child to see an eye doctor so that if the child requires glasses, then that child should be given glasses. Because if these issues are not addressed, they can impact on your child's quality of life dramatically and make learning in school even more difficult than it should be. Do you also know that you may unknowingly be causing your child to need to wear glasses? Do you know that? More children are now requiring glasses. In the last 10 years, those who require glasses have doubled. Why is this so? Now, the reason is because the use of smartphones have increased. Now it is more affordable. We have more middle-class parents buying such for their children. The same thing, play is also reduced. People don't go out to play as often as they used to go. And then these children begin to develop short-sightedness. Now, how do you prevent this in your child? You need to practice the 20-20-20 rule. What is this, you may ask? This is done to rest their eyes. What you do is your child reads for 20 minutes, then he looks away for 20 seconds, about 20 feet away, to rest the eyes. This is very important. You also need to look at the guidelines for screen use in your child. It's all over the internet. You check the guidelines and you follow these guidelines for the instructions for screen time. If your child is allowed to have only 30 minutes or 1 hour, stick to that time. Then there are a few more things that you can do as eye care providers if your child is seen by us. This will help to improve your child's eyesight and we preclude the need for wearing glasses. So as a professional, we recommend scheduling routine eye exams for your child. When they are 6 to 12 months, they need to be seen. When they are 3 to 5 years, they also need to be seen. And once they start primary education, they need to start seeing the eye doctor annually. By making eye exams a routine part of your child's medical care, we can help detect vision loss or visual issues early and correct any problems as quickly as possible. As a parent, are you quite certain that your child can see very well? This is a question you need to think about. And that is what I wanted to discuss with you.